Americans spend billions of dollars every year in the quest to look younger, more beautiful, thinner, all those things, but not every plastic surgery story has a happy ending. There can be scarring, tissue damage, even death is a very real complication. So we're talking to board-certified plastic surgeon Dr. Anthony Youn this morning about certain questions you need to ask, perhaps what your plastic surgeon does not want you to know. Dr. Youn, thanks for being here.
Thank you.
I know you're such a busy guy. I want to get right to it. The questions that you need to ask your doctor, just give us an idea of what we should be doing, our homework.
Well, the number one thing is make sure you have a surgeon certified by the American Board of Plastic Surgery. And unfortunately, there are a lot of doctors out there performing plastic surgery who really aren't qualified or trained to do it at all. So that's the number one thing.
Okay. And so board certification, you ask other questions about how many patients they've done the similar procedure on, those sorts of things?
Exactly. So apart from that, look at things like before and after photos. Make sure that those are the photos by that doctor. Make sure you ask them, are these your patients? Make sure your doctor sits down with you and does an actual face-to-face consultation. If you don't meet with your doctor before surgery, you know, that's a sign that your doctor may not be spending a whole lot of time actually performing your surgery, which is obviously a big red flag.
All right, and you talked about make sure they have hospital rights at a reputable hospital.
Exactly, and I'm a Beaumont doctor, and you want to make sure that that surgeon can perform that surgery in a hospital. Hospitals will do your homework for you, and if they don't allow your doctor to, say, perform liposuction at their facility, then that means they're probably not trained. Yeah, that means they're probably not trained for it.
Okay, one of the questions we got in the chat room is what are the real risks when it comes to plastic surgery? So I want to go over what can go wrong potentially. Reactions to anesthesia is one of them.
Well, the first thing, if people say, well, Dr. Youn, what's the worst thing that can happen with surgery? My answer is, well, you can die, and then we kind of go from there, because plastic surgery is serious. So definitely make sure safety is number one priority. You have it done either in a hospital setting, like once again, I work out of Beaumont, you know, other very well-regarded hospitals in the area, or make sure the surgery center is certified and accredited as well.
All right, I want to let's get to our pictures, Dr. Youn, because, and again, these pictures kind of reflect some of the questions we're getting in the chat room and in the email. We talk about REID, and we're using her because you can see there, this is a very thin woman, and look at her stomach. What is this a sign of, doctor? And I know you know the people who worked on her.
Oh, exactly. And a good friend of mine was one of the people who tried to help fix her. Basically, the moral of this is you can be too skinny for liposuction. So liposuction can actually make you look worse if you're real thin and you have it done, because it can create unnatural depressions and scar tissue. And that's what I believe happened with Tara. She probably would have looked a lot better without having anything done at all.
Well, and liposuction, do you believe that it works? Because I hear some people talk, some people are very outspoken, Kathy Griffin for one, about how it didn't work for me. They suck the fat out and just more fat comes back, or does it work?
Well, as long as your weight is stable, then it does really work. The fat cells that are removed do stay off. However, if you, let's say you gain weight or lose weight afterwards, then there's no way to predict how things are going to look afterwards.
This lipo is not the quick fix that people think it is, right?
And it's not a way to lose weight. So people, you know, who are overweight, it's not a way to take off 10, 20 pounds easily. I mean, there's a lot of easier ways to do that, you know, working with a personal trainer, that type of thing.
All right, I want to show your picture that you brought us of a patient who came to you. What had happened to her? You see her the before. She came to you on the left, and so she had procedures.
It's a very nice woman who came to see me. She saw a different doctor in town who was not a board-certified plastic surgeon. She wanted a tummy tuck, and he said, no, liposuction will remove all this loose skin and tighten it up from your belly, which was a lie. So she had the surgery done, was duped into it, and that's how she looked like when she came to see me. When she came to see me, I said, look, you need a tummy tuck. I mean, that's the only way to get rid of the skin. And so the second picture is how she looked after the surgery she should have had done in the first place.
All right, let's tackle a viewer email, Dr. Youn. One woman writes to us and says that I am morbidly obese, and can I still have liposuction? This is from JM in Detroit. I'm female. I weigh about 290. That sounds like a recipe for disaster, doctor.
Yeah, so the number one thing is you need to be healthy if you're going to have elective plastic surgery. So that's the number one thing. So the fact that, you know, you are a bit overweight and that type of thing, you need to see your doctor first. And second thing is liposuction isn't a way to lose weight. I do see patients like that who'll come to see me and they think it's a quick fix for them. A better option, if they can't lose the weight on their own, is to consider bariatric surgery, like maybe a bypass or lap band.
Okay, I want to get to one more email question. from P3 in Brighton, talking about quick fixes. We hear a lot about
quickie facelifts
and whatnot. Do those work?
Well, the number one thing to remember is if it sounds too good to be true, it probably is. Can you literally lose 20 years in the span of 1 hour and then go back to work right afterwards? And my belief is no. I think that, you know, there's a reason why board-certified plastic surgeons like myself do not perform quickie 1 hour, half-hour facelifts, because they don't work.
Well, and why are people in such a hurry to have surgery? I mean, why are you trying to squeeze surgery in on your lunch hour, right?
Yeah, exactly. So the most important thing is sit down with your surgeon, make sure that things make sense. There's no magic in plastic surgery. I don't have a magic wand I can wave over your face and take 20 years off.
You don't?
Yet, unfortunately, some doctors kind of claim that they do, and it's unfortunate.
All right, be careful. Do your homework. That is the bottom line. Ask the questions. All right, Jason, we're going to stay in the chat room over here. We'll go back to you.